2022 and welcome to the fourth episode of the Curtain Raiser of WIROC Max 2022. As we all know, the annual conference of the Bombay Orthopedic Society is scheduled from 29th December to 31st December 2022 at the Geo World Convention Center, Mumbai. This annual flagship event this year will leave no stone unturned, and we are looking forward to see you all in physical presence over there. As it was said, as we live behind the pandemic, and as it said, if you can't cure it, endure it. We are leaving the pandemic behind, and after 2 years, we'll be running this conference in full-fledged. We look forward to welcome you at this grand event. At the onset, may I call upon the organizing chairman of this conference and the president of Bombay Orthopedic Society, Dr. Rajesh Gandhi, to say a few words. Over to you, Dr. Gandhi, sir.
Good evening, respected teachers, seniors, and dear colleagues. We welcome you to the curtain raiser of WIROC 2022. There is a quantum change in the way the orthopedic surgeons are practicing today. There was a time when the orthopedic practice was primarily in a small nursing home or a public hospital. Few amongst us, like respected Dr. Sancheti sir, Dr. Vikram Shah, and Dr. Raj Sekharan, to name the few, have started the institutes, namely Sancheti Hospital, Shelby Hospital, and Ganga Hospital. They have set the benchmark by starting the world-class orthopedic institutes across the country, and they have attained a global recognition. On the other hand, there was a surge in the institutional practice, where the surgeons were comfortable with facilities available at the institutes, where they could work freely without any pressure of building institutions. We have today to discuss both the aspects by a very elite panel of Dr. Respected Sir, Dr. K.H. Sancheti, Dr. Parag Sancheti, Dr. Ram Chaddha, and Dr. Manish Agrawal. Thank you.
Thank you, Dr. Gandhi, sir, for those kind words. We move over to our program of this curtain raiser, and the theme for today's program is the era of institution building and corporate practice. The first half will be dedicated to institution building. As we all know, it takes great efforts to set up an institute, and one such pioneering institute which stands tall in our country is the Sancheti Institute of Orthopedics and Rehabilitation located at Pune in Maharashtra. This institute was started by none other than Dr. K.H. Sancheti, who pioneered this and started this institute way back in 1965. This institute has grown leaps and bounds over past 6 decades. Dr. K.H. Sancheti has himself started the indigenous hip and knee system, which is being used across our country. For his efforts in orthopedics and rehabilitation, as well as in medical education, the government of India conferred upon him the civilian awards of Padma Shri way back in 1991, Padma Bhushan in 2003, and Padma Vibhushan in 2012. The Medical Council of India conferred upon him Dr. B.C. Roy Award also. Let's hear from Dr. K.H. Sancheti, sir, his experience as he looks back over 6 decades of setting up this institute, which has grown from 10 beds to 300 beds today. Over to Dr. K.H.S., sir.
Namaste. It's pleasure for me to talk about my past, and let me take you to back in 1961, where I completed MBBS. Then I did one year's post here, and from 1st March 1963, I got the post of registrar in KM Hospital, Bombay. In fact, I was given before the 1st March, that was a convalescent home, and I was given appointment in the convalescent home. But to my great luck, on that day, they brought all the orthopedic department of KM Hospital, Bombay, in front of the Tata Memorial Hospital, Parag, and then I became the first registrar of that new center. Being a registrar, I got a chance to work and did a lot of surgeries, hip, fracture fixation, etc., etc. And therefore, after doing MS Orthopedics in November, on 12th December 1965, I could start the practice. I started the practice with 10 beds in a rented place, that is Motwani Nursing Home, which was in front of the modern high school on Jangli Maharaj Road. And from there, I wanted to grow all the time. I was I never like to be a stagnant. I was satisfied whatever I achieved, but that zeal, grow was tremendous. That I got from my parents, and that made me to work more. Then what happened? After 2-3 years working in Mufani, in Tube Park area, there was one bungalow constructed by Kale, and one of his patients came to me. He, I think, or somebody, and then we just talked, and he sold that bungalow to me and shifted that 10-bedded hospital from rented place to a hospital next to this present hospital, that is Tube's area and Kiret's Bangalore. I took it, and then I constructed first hospital there to start with 25 beds, then 50 beds, and then again I got this place which was belonging to agriculture college, and there was Jhopatpatti here, so we got the Jhopatpatti vacated, and then revenue department took the place from agriculture department and gifted us for hospital. Here, but for that I had to make a trust. So I made a trust in the name of my father, that is Hastimal Sancheti Memorial Trust. So this was one pillar of my practice of patient service. While doing patient service, I felt the need of education. As the beds were growing from say 50 to 100, then 150 again, this was growing on one side. And then there was a need of education to a physiotherapy college, MS Orthopedics, hospital management college, that I simultaneously started. And the education became the second pillar of my activity. In fact, there is no other hospital where it is run by trust and not a medical college, where the MS orthopedic seats 20 per year are admitted. We are the unique, for which I am very proud. MS orthopedics is there. People can do PhD also in our hospital, and that's how we are going in education. But only education is not sufficient. Again, for you to keep the modern equipment and modern development intact, you must have research angle. So simultaneously, I created a department for research, appointed a research fellow, and I was conducting in the early practice a lot of polio camps, and then the data I collected and a lot of research work was done and still was going on. Dr. Ashok Sham now is taking care of our research department, and the publications done by our hospital by different consultant is remarkable. In fact, at present, we have got 3 units of spine surgery. They exclusively do spine and nothing else. Another 3 units of trauma, where they do selectively trauma and nothing else. Then 1 unit of hand, 2 units of hand surgery, 1 unit of shoulder, then hip replacement 1 unit, knee replacement another unit, and arthroscopy and pediatric orthopedics is another unit. So there are so many units which individually are doing research, and lot of research work is published in our hospital. Now after that, the third pillar, the fourth pillar is legacy. In legacy now, I have started my practice in 1965. 57 years were recently completed. But at the same time, my son, Parag Sancheti, did MS Orthopedics about 20 years before. And now he is so well conversant and matured enough to take care of this hospital. So I handed over to him the chairmanship, deanship, and managing trustee, etc. And I'm glad that he is doing that job very well. Well, while doing all this, my polio service work in medical field, which I did free of charge, was recognized by Government of India. And in 1991, they gave me Padma Shri. Then 2003, Padma Bhushan. And then in the meantime, then I worked on indigenous knee replacement, indigenous hip replacement, etc., which, because foreign implants to change the joint were very expensive, and I wanted to create a joint in 1/4 of the cost than foreign joints. I succeeded. I got the patent for that, and I shifted my focus of service. In the initial period, it was pediatric, means polio children. From pediatric, I shifted to geriatric, and a lot of work I did in geriatric. And again, Government of India recognized me. That is, President of India recognized me, and they offered me. I was decorated with Padma Vibhushan. So Padma Shri, Padma Bhushan, and Padma Vibhushan. And there is one more very prestigious recognition in Medical Council of India, and that is B.C. Roy Award. This particular award is the highest award in the medical field and given by President of India, which also I got. Now, after seeing this growth of patients, growth of hospital on one side, name and good service on another side, I realize in life, first and foremost thing is to help others, and that I started from initial period in service and satisfaction to the patient. This service and satisfaction to the patient kept motto so high that my all other colleagues, about 25 orthopedic surgeons are working with me in our hospital. They adopted the same approach. First is a humility. The more you grow, the more you should become humble. That one part. And another part, be kind and do service to the patient. Treat patient as God. Like that, that involvement I find in my colleagues in our hospital, my son Parag, and I am very much satisfied in life. So what more one needs than this? That is all. Money is never a criteria which I had in my life. But these other aspects I gave importance, and then I am the most satisfied person today So, very happy to talk to you all, and thank you very much.
On behalf of the organizing committee of WIROC and Bombay Orthopedic Society, and we are indebted to that message from Dr. K.H. Sancheti, who has trained over 200 orthopedic surgeons till date and has offered his expertise to several hospitals across India in the area of hospital design. He continues to inspire and train orthopedic surgeons and is a strong foundation on which Sancheti Hospital stands today. He is indeed a source of inspiration to all the budding young orthopedic surgeons who are looking forward to set up their own institute. It is said that destiny is not a matter of chance. It should be a matter of choice. And it's not a thing to be waited for, but rather a thing to be achieved. And Dr. Sancheti, through his acts, has proved that one should construct his own destiny, construct his own institute, which is the best area to work. Our next speaker is the person who is carrying forward the legacy of this very institute, Sancheti Hospital, and it's none other than Dr. Parag Sancheti, who is today the chairman and the dean of Sancheti Institute for Orthopedics and Rehabilitation. He is a specialist in arthroscopy and joint replacement surgery. He has been a past Secretary General for Asia Pacific Knee Society and also the past president of Maharashtra Orthopedic Association and Pune Orthopedic Society. He has over 50 publications in various national and international journals. Over to Dr. Parag Sancheti, sir.
Good evening, everybody. I'm Dr. Parag Sancheti from Pune. On the outset, let me thank BOS President Dr. Rajesh Gandhi, Organizing Secretaries of WIROC, Abhijit, Kale, and Ashish Phadnis for this opportunity given to me to speak at the curtain raiser of WIROC Max 2022, which is going to be held at the end of this month in Mumbai. I'm sure this is going to be an exciting conference and I'm looking forward to it. You just heard my father, whom we popularly called as KHS sir, speak on a legacy which he has created, a journey of 57 years. He highlighted 4 pillars: patient care, which of course is still very important, education to doctors, research and innovation to find out solutions which are required to optimize the results of a patient with high quality and affordable cost. With this, I want to stress upon the tradition, technology, and teamwork. I think it is important for the legacy which Dr. K.S. Sancheti has created to add to it technology. So I want to say that technology blended with tradition is the way ahead now. Technology is very important for us to keep abreast, not only in the field of orthopedics, but all across. We are having new modalities of treatment, new technologies are coming, and therefore, for us, that is the way ahead. People are doing robotic surgeries, surgeries with O-arm, with neuromonitoring, and all this is to make the surgery more safe and to give it a predictable outcome. Artificial intelligence, virtual reality are coming in a big way, and that is very, very important for us to adapt so that the patient will get an optimal result. So the important thing for me here is to blend technology with tradition. The second point which I want to highlight is teamwork. And today, gone are the days of a single surgeon starting a hospital. People are moving away from single specialty, single surgeon practice, and they are moving to a practice where there are more than 4 doctors, orthopedic surgeons coming together and starting a 50-bedded hospital from a 10-bedded single surgeon owned hospital. And now the time has come to do a group practice or a joint practice. And for this, may it be an institute like Sancheti Hospital, which has 150 beds, or a smaller hospital which has 25 beds, time has now come for teamwork. And this is the second point which I feel is going to be very important as we look ahead in the orthopedic practice. Patient experience is the most important thing for me. And today, patient look at hospitals as a hospitality industry. It's like going to a hotel. People definitely want good outcome, good treatment, but what they also want is good hospitality, and that is what which we need to give to our patients. It is also important to understand that today the patient has multiple options. The patient can go to various hospitals, and therefore for us we have to make sure that what we give him is the best, what we give him is with the latest technology and is going to give him a very good outcome. So this is what we call as scaling up. And I just want to inform you that on Friday, that is the 30th of December, during WIROC Max, we have a wonderful session which is going to be called as Scaling Up. And that session is going to be scaling up from aspirations to ascent. This session will be moderated by Dr. Taral Nagda and myself, and we are going to talk on various aspects of how to move ahead, how to scale up. We have 4 star speakers: Dr. Devi Shetty, who is going to speak on value in volumes; Dr. Gurva Reddy, who is going to speak on multiplier in orthopedic practice; Dr. Shekhar Bhojraj, who is going to speak on scaling up to masses; and Dr. Kashyap Adarshana, who is going to speak on self-scaling. This is going to be followed by a panel discussion with all the 4 panelists, and of course we are going to have a very big audience interaction. So friends, as we look forward, the medical practice is changing. Gone are the days of single surgeon owned hospitals. We are now moving to teamwork, group practice, adding technology to tradition, and therefore I would say for you to attend this session on scaling up is going to be important. I once again thank my friend Abhijit Kale for this invitation, and we are all looking forward to WIROC Max. I'm sure this is going to be a great event, and this is going to be held at the brand new center, the Geo Convention Center. So friends, I request all of you to please attend this conference in large numbers, and especially be present for this session on scaling up from aspirations to ascent, which is going to be a game changer in your practice. We just heard KHS speak on his legacy, how he created 57 years the institute, and I'm going to speak that time on how to take it ahead. I'm going to speak on from 150 beds to go to 300 beds, which we are starting in the new hospital. We are adding 8 more ORs and definitely going to change the way practice is being done. So friends, I look forward to seeing you at the session Scaling Up at WIROC Max on 30th December at 4 p.m. See you then. Thanks Rajesh, thanks Abhijit, and thanks Ashish for this opportunity. See you soon.
Thank you very much, sir. Thank you very much for an interesting insight into what went into the mind of KHS sir, and from where he started to where he is and where we are looking forward to next. As we move on from a single person or a single unit-led institution to our dear friends and mentors, Dr. Ram Chaddha, who's the leading spine surgeon, and Dr. Manish Agrawal, who is a leading ortho-oncosurgeon. We have seen both of them over the years, right from the days when they started in different hospitals in Bombay. I've seen Dr. Manish Agrawal as a resident when he was a lecturer and an associate professor in KM, moving on to Tata Memorial Hospital and the Hinduja Hospital, and now in Nanavati. Dr. Ram Chaddha, who is the current president-elect of the Indian Orthopedic Association, has been a past president of our Bombay Orthopedic Society. We know he was in Miyot, and then I've seen him in Lilavati, Apollo Hospital, and in Global Hospital. So both of them bring to this forum a vast experience over the last 20 to 25 years when they have seen multiple hospitals which have either been led by a team of managers, or they have been led by visionaries, and both in the public sector, private sector, and now the managed healthcare or the corporate sector. So we are looking forward to a conversation between two friends, two colleagues, and two orthopedic surgeons to sort of, allay a lot of doubts that come into an orthopedic surgeon's mind immediately when we mention a corporate hospital, or also to highlight certain advantages and comforts that an orthopedic surgeon would get in executing his surgeries or giving a service to the patient when it comes to practicing in a particular institution. So I welcome you all, and I welcome both of you, sirs, Dr. Ram Chaddha and Dr. Manish Agrawal, to take it forward.
Thank you, Ashish. Let's begin by me asking Ram first. Now, after all this experience, as we said, right from medical college to a corporate sector, what do you think about a corporate hospital? Because as Ashish said, commonly corporates are known to be villains in the life of doctors, and we consider them bad elements. What do you think about your experience now?
Thank you very much, Manish, for the question. Thanks, Ashish and Abhijit, for getting all of us together. I'll be very frank with you. Today, with larger number of orthopedic surgeons being churned out each year, and with actually the need and the demand increasing for qualified orthopedic surgeons and subspecialties, we do need a better structured environment for us to deliver our goods. Individuals like Dr. K.H. Sancheti, Dr. Vikram Shah, Dr. Rajsekharan, mentioned by our president, Dr. Rajesh Gandhi, would always be there. However, such visionaries are exceptions to the rule. The rule is that there would be Manish Agrawals and Ram Chaddhas who would need a proper institution, a proper setup, where we need the team, the technology, and as mentioned, some tradition or legacy coming down, which would entail a lot of effort being put in by a large group of people, not necessarily orthopedic surgeons, and hence the need for a corporate setup. Unfortunately, the problem comes where we have a manager working above an orthopedic surgeon rather than an orthopedic surgeon working with a manager. As I look at it, if we have an institution where the head is an orthopedic surgeon, the heart is the orthopedic team, and the neck is the manager, it can be a big success story. However, if the head is a manager and the neck and the heart are orthopedic surgeons, then things start going amiss. This is what I have gathered in my journey from 1989 when I qualified as an orthopedic surgeon in the month of January. Went through Sion Hospital, left as an associate professor, went to MIOT Hospital as mentioned by you, worked in a predominantly orthopedic setup, which was one of the large orthopedic subspecialty institutes in the country, came back, then worked in this huge corporate called Lilavati Hospital. Also had probably the advantage of working in the largest Apollo Hospital in West Zone, which is at Navi Mumbai. And I'm now back to where I started, which is Lilavati. So I've gone the entire circle, and I still believe that there is something good, and we have to somewhere draw a line between performance and trust. If we are going to excel in performance, we have to trust the institution. And if the institution trusts the individual that is performing, then it's a win-win. Otherwise, lack of trust is interpreted as lack of performance, and performance takes time. So in brief, I've given you an overview of what I feel between 1994 December, when I stepped out of Sion Hospital, and 2022, when I am at Lilavati, going the entire circle. I'm sure Manish, who has gone through not an identical, but a similar set of experiences, would have inputs to add to this, edit this, modify this, and we can then move ahead. Manish, all yours.
Yeah, so Ram, I think I completely agree with what you said about the corporate hospitals. I think the problem has been where managers are not aligned with the orthopedic surgeons in terms of which direction they want to go. So the aim of the corporate may be just to improve their finances and make profits, and orthopedic surgeon may want to deliver quality, and there will be times when these two are not going to match each other, and that's where the conflict would come. So I think it's very important that anybody who's choosing a corporate hospital actually chooses something which fits in with their goals. So like, for example, when I wanted to step out, I did not ever bother about what the corporate would pay me. My intention was to accept the challenge of bringing in orthopedic oncology into the private sector as a separate specialty. And for that, I required a lot of help from the hospital in terms of infrastructure, in terms of staff, in terms of, bearing out till the time these numbers could increase and the hospital would find that this field is viable. So I think that is where Hinduja Hospital gave me that support. And also very important to me was the ability to do charity along with the other paying patients, because I think all of us realize that we want to do our bit for the society. That's a kind of a payback and job satisfaction. Some of the most challenging cases come from the poorer class, and very often you don't want to send away a patient just because they can't afford treatment. So again, a corporate like Hinduja was very useful in allowing me to do as much charity as I wanted to do, and that's the reason why it continued for such a long time. I spent 10 years there. But again, time comes when field changes, and if again the corporate doesn't keep pace with the technology, with the needs, or what that field requires, then again a gap comes in between what you want and what the hospital desires. And that's the reason when you have to make a change. And I like the concept now at Max Hospital where, like Ram said, the management has to work alongside with the surgeon. They ask you what you require and they give you everything that you need. And in return, you have to give them the performance that one has promised. So no corporate would like to have a surgeon who does not bring in patients or does not bring in something to the hospital, whether it's in terms of a name, in terms of academics, in terms of research. Something has to be brought in which is going to be of value to the institute. And then only the surgeon can survive in that. And once that is met, then I don't think there is ever a mismatch between what has been promised and what the goals are between both the management as well as the surgeon. So again, my question to you, Ram, is that I know that in corporate hospitals, we do have good infrastructure and we can deliver good medical results. But what about the research and the academics? Do you think that it is possible to get a balance between the work, the clinical work, as well as research and academics?
Well, I would be comparing apples and oranges if I would compare or put all the corporate hospitals at the same level. I'm trying to now differentiate into orthopedic surgeon driven or run corporate type structures or hospitals, 3 of whom I've named, and there are at least 10 to 12 more in our country, where academics and research is really placed at an extremely high level, and which is actually giving them not just national, but international recognition. And these are people who are looking at an infinite game and not at a finite game of achieving something in a short period of time. Vis-a-vis multi-speciality corporates, where the academics and the word research have a slightly different meaning to it, and which is to complete the tagline that is a part of the name of the hospital. Yes, the very fact that a lot of diplomate national board MNAMS students are now getting attached to large corporate hospitals forces them to have everything that you need, like a research wing and an education wing and a library and an ethics committee. So all these things need to be incorporated. But I still believe and feel it has to rise beyond that. What the corporate hospitals do, and I'm happy to say that, is that they are actually more vigilant on getting the quality controls, whether it's JCI, NABH, these things they are, because probably it adds value to them nationally and internationally as a large setup. And it also makes them medico-legally more secure in this rather VUCA times that we are facing in the healthcare industry today. So they do work very hard on quality, but they may not necessarily work hard on subspecialty growth, like surgical oncology and orthopedics, or maybe spine surgery, or maybe minimally invasive surgery, or technology-driven surgery. The problem with the corporates as far as technology-driven surgery is that the managers know that new technology lasts for 4 to 5 years, and then something else replaces it. And then they need to look at those 3 letters, which they call ROI, which is return on investment. And unfortunately, they link the performance of the surgeon to the utility of technology, which may not necessarily actually translate into good quality care. And that is where the mismatch comes. However, when you move from a purely corporate to an orthopedic surgeon-driven institute, the choice of technology is not necessarily the one which is the most fancy or the one which has the largest sort of appeal among the masses, but one which actually drives towards a safer surgical result, if so be it. So like you realize what Dr. Parag Sancheti mentioned, he mentioned the O-arm, he mentioned neuromonitoring. Now, these are things which we all know add value and make surgery safe. So they may not add much to income, but they surely add great to outcome. So this is something which would not necessarily gel in with the thought of a corporate, which would say that they want the latest robot and they want the latest gadget, which can be sort of photographed and sent across to the rest of the world. So somewhere, as I look at it, my look into the future is orthopedic surgeons need to get together and create a large multi-speciality institute, which unfortunately the city of Bombay, Mumbai is still lacking. And that is why Manish and I are here trying to sort of drive that point home, that we have large institutes in Maharashtra, large institutes in Gujarat, large institutes in Tamil Nadu, which are surgeon-driven, which are focused on orthopedic care. But Mumbai, for some reason, needs that to happen. And here I'm opening a Pandora's box, as I may put it, that we in Mumbai need that. And probably somewhere, somebody has to get up and put his hand up, because we've had few people who've tried to do it, but for some reason, it doesn't seem to work. So we need people to get together and create it. That's where I am, Manish. So I feel that we are still lacking and lagging behind in Mumbai. I don't know what's your take on it.
Ram, for me, it's very different because the kind of environment I requires multiple disciplines to be involved with the care of the patient. So I require multiple disciplines of oncology as well as multiple disciplines of medicine and surgery. So in one particular case, I will need a vascular surgeon, I'll need a GI surgeon, a neurosurgeon, I'll also need a cardiologist, I need a good physician or an endocrinologist. And all this is not going to be easy to get in an orthopedic institute. So for this, we require a multi-specialty hospital to run this particular field. And again, I see a clear difference between Tata Memorial, which is a cancer specific hospital, versus, say, when I started practicing at Hinduja, that the kind of cases that I could take on and deliver good results in were everything which, many of those which I could not take at Tata because we didn't have that particular medical specialty or a specialist to take care of. So what I think is required to be done is these multi-specialty institutes actually providing the orthopedic services at these corporate hospitals. So I think if that concept can come in and if they can run the orthopedic departments as someone which has been outsourced to them, I think then it is possible to get the best of both the worlds on that. That's why I think there is a place for multi-specialty hospitals, but like you said, I think they have to become sensitive to what the super specialty needs are. Particularly if you're running in a major city like Mumbai and you're a tertiary care hospital, it is very important that the subspecialties are very well taken care of. And again, as you pointed out, I think there has to be a timely change in the technology. So any technology which now we know is better for the patient, makes surgery safer, or gives better outcomes, I think the hospitals have to be quick to accept that instead of trying to calculate what is this ROI. Because when you look at the whole thing, when you take on the complex cases, the easier cases also flow in. And this is something which we have seen in oncology. So the capability of delivering good results in a complex case will also bring in standard, easy case volume to the institute. And once they understand that, I think there should not be a problem or any conflict in providing this kind of equipment that the surgeon needs. It's also an incentive for the surgeon to do better and better and to stay in one place and have a loyalty to that particular institute instead of looking at other centers. And as soon as the management will realize this, I think they will realize the value of cultivating or even growing and incubating their team of surgeons. What do you think, Rama, will be the shortcomings of a corporate hospital now that we've seen? I mean, and how do we resolve them? From the patient side and from the doctor's side, let's put it in two ways. I mean, we've discussed a little bit from the doctor's side, but let's say from a patient's point of view, what do you think are the major shortcomings in a corporate hospital compared to, say, an orthopedic hospital or a nursing home?
Well, primarily, a corporate hospital is looked at by a patient who is out-of-pocket payment as an expensive option. Let's understand that primarily. And we have a large majority of people in our country who are still out of pocket. They are not insured. And those who are insured are unfortunately not comfortable with the insurance because they believe that they should be insured for everything, including outpatient care. So that mismatch between what they thought the insurance gives and what they actually get has made them more uncomfortable. But as I look at it, the level of the public hospital has to first be increased to take care of the masses. And the corporate hospitals right now are taking care of just the classes. And there's this huge middle class in between, which is the place which is tilting somewhere in between to maybe a nursing home or a lesser hospital, which needs to start developing the faith and the confidence in the large corporate hospitals. And that is what is going to actually push the corporate hospitals ahead. Now, you've taken the name of Hinduja Hospital, and I have a huge respect. It's one of the earlier big success stories in the city of Mumbai. And something which you have used there, and which I believe I have never had the opportunity to be in Hinduja, is that they have a very, very good social work division or a social worker division which supports, which actually does a triage and finds out that a particular patient cannot really afford treatment and tries to help them in more ways than one. Now, that aspect of a corporate hospital is very, very critical. And if we have, let's say, all the corporate hospitals going along that line, then a large number of this middle class would start developing the faith in the corporate hospitals and not have the fear of a corporate hospital. This is something which you have realized what happened in the pandemic as well, where there were a lot of people who were a little bit unhappy with the corporate hospitals who were actually going far beyond what they were actually supposed to deliver. I mean, we were there and we know that they really went far beyond and struggled to make ends meet, but they tried their best. But that fear and apprehension was there. So somewhere these corporate hospitals need to strengthen their, sort of patient support systems and somehow get sort of help. Because one thing which I don't know whether you've realized, Manish, but I have realized it, that we have found when people look for public funding for large amounts of money, and it may be in huge amounts of 30 lakhs, 40 lakhs, and 50 lakhs, people do manage to get those. And that is what surprises me, that public funding requests, people get help. But a fractured spine patient with incomplete neurology is struggling to get operated. So somewhere we need to sort of change the system and get the guys who are actually running those public request funding as social workers to these hospitals and somehow make it work. I don't know how it was in Tata, because I'm sure in Tata also you had a lot of support from these people. So I would like to know how that works so that it can be ingrained into the corporate hospitals.
I think every hospital has a different strategy. Like at Hinduja, so they themselves from the trust fund itself would allocate a huge corpus for these patients. And almost 1/3 of our patients were treated as charity. So that is a sizable chunk for any public hospital or any corporate hospital for that matter. At the same time, I don't think this distribution of charity was uniform. And what I realized was that you have a lot of help for the very poor, and you have the middle class, which is actually left in a lurch because they are not poor enough to fit into the criteria where they would get helped, and they can't afford the full expense. And there doesn't seem to be any category for them, or there is no organization which actually helps them. So we had actually created a fund with NGO called WeCare, where they would get supplemental funding, like up to 50,000 or a lakh of rupees for their care, what they were falling short by. And that itself was a big help to a middle class family to afford to get treatment. So again, a hospital like Reliance Hospital, which I'm seeing now, has a very good general ward where the treatment costs are pretty reasonable. And if one can get this kind of help, about a lakh of rupees, and the patient can spend about 50,000 or a lakh of rupees, they can get very major surgeries done with very high quality treatment for this small amount of cost, which now the middle class families are able to afford. So I think something like that has to start happening across the hospitals. And many of my patients who were not able to pay the full cost, I was able to make a WhatsApp group of people who have expressed their interest in donating, whether it's friends, families, past patients, etc. And I would put a request on those groups, and I still do, and we get the funding. There is no patient who is so far not got funding from these requests. So I think somewhere down the line, we also have to take the initiative and work with the corporates and try to create an environment where, like you said, they need to have the trust that when they come here for this kind of cost, they get the highest quality medical care and they can get treatment. And again, one big shortcoming which I find in corporates is that for smaller surgeries, something like say an appendicectomy or a hernia operation, corporates are very expensive. Whereas for very big supra major surgeries like a bypass or say major onco surgery, I think they become pretty reasonable, particularly if you're looking at the twin sharing room or the general ward. So this disparity has to come down. I think the corporates need to find a way of delivering these easier surgeries at lesser costs, or the lesser grade surgeries at a much lesser cost than what they're able to give today. I mean, today I have a big problem because just a needle biopsy taken in the operating theater for a 5-minute anesthesia is costing 60,000 rupees. And I could probably do the same thing in my OPD in local anesthesia for 5,000 rupees. So this cost difference for taking a patient into theater for something very small, the cost is huge. And this is something which I don't know how to get it low. And we are trying to now work with Max to give them a package for these smaller things.
Any questions that come to Ashish's mind or Abhijit's mind or Ashok's mind that Ashish,
You're mute. Mute. Ashish, you're mute.
Yes, sir. So I would like to ask one of the, I mean, both of you are working, have moved from a public sector to a private sector hospital. And most of the consultants who work in a corporate hospital, not as full-time, but do get their complicated cases, so as to say, often complain that this is a faceless hospital. Most of the corporate hospitals are a faceless hospital. There's a small nursing home, that surgeon is the face of the hospital. And the argument is that there is compassion, care, a single person led sort of care to that particular patient. So the patient has a slight amount of comfort zone. So have you seen such a kind of a comfort zone in a corporate hospital wherever you have worked? Or would you still say that it is a faceless hospital? What I mean to say is that, you identify a particular hospital with a surgeon, but when you go to a corporate hospital, there is no one surgeon that is identified with as the face of the hospital, So that is what I mean to say. It is an entity. It is a big corporate entity. So the patient often feels lost because he's moving from the billing counter to the pathology counter to then getting admissions, then waiting in the queue for, getting a discharge. So there are processes in a corporate hospital which do they make things difficult for the patient rather than streamlining it?
Well, I'm going to answer that in a little different way. There's a difference between a patient coming to a hospital for the first time for emergency care versus a patient who's come through the outpatient, has gone through the ritual of examination with X, and then decides to take the investigations in the hospital and then has a discussion with X about the surgery and then decides to undergo the surgery with X in the same hospital. So that is the normal route or the way that it works. There, fortunately, in the city of Mumbai, and I'm sticking my neck out and saying that it's still very much a doctor-patient relationship and which dictates the line of treatment. So that's the good part of our city where we are. However, in an emergency situation, yes, where let's say somebody is coming to a hospital which has a name or an entity. Let's say Sancheti Hospital. If there was Sancheti Hospital in Bombay, and if an emergency is coming to Sancheti Hospital, they have heard of Dr. K.H. Sancheti and Dr. Parag Sancheti and would like to reach out to that person. And everybody, as mentioned by them, the 25 orthopedic surgeons are actually clones or creations of the two who are leading the show and speak the same language. So that's good. So that's how they relate. But if you're looking at somebody walking into a Max or a Lilavati or a Jupiter for the first time, they will have to go through the triage of the casualty and the emergency. So that aspect may be faceless to begin with. But then the moment they touch base and connect to the individual who's treating them, then it's that individual's care, compassion, whatever you want to use the words that you've used, which is going to then lead the relationship to the next level. So I look at it that medical care will never be a metric. It will always be more than that. It's the heart that's going to rule the head in medical care. So there is going to be that compassion and that warmth and the empathy, which is going to be there all the time, and which is going to get that patient back to that hospital or to that doctor. And fortunately, and I'm very proud to say that Mumbai is probably that one city where it still works, where it works above the branding of A hospital, B hospital, or C hospital. That's a good thing. Over to you, Manish.
Yeah, so again, where Mumbai is different from, say, even Delhi, is that people actually come to hospitals because of the reputation of certain consultants who are attached with that hospital. And when they come in and they know, they would contact that particular team and then come into the hospital, so they're taken care of. And even if they come without knowing anybody, if the emergency services are well prepared to handle anything for the patient and make it easy for them, then it's not so difficult for them to settle in and then make contact with the primary team. Now, after they make contact with the primary team, I think we all now realize the value of patient coordinators who actually help them with every part of the hospital. Like now I have a coordinator when I have shifted to Max who helps the patient with estimates, with their billing, with their admission. And we have a specialist nurse who takes care of the pain management, of the drains, of the dressing. So there is no way that they are left to fend for themselves in the hospital. They don't get lost. And I think more and more hospitals have realized the value of this, and they are actually giving these unit-specific people to take care of the patients who are dealt with by that particular specialty. So I think that is one way in which treatment is done. And I think in Mumbai, at least the emergency services of most of the hospitals are pretty good. And they are geared up to handle anything major which comes in, and they put the patient on to the primary consultants pretty quickly, who are there on call in most of the hospitals.
Thank you for that wonderful input. It has been a constructive discussion by both the panelists. The one question from my behalf. So today, if we look at the healthcare system in the city of Mumbai, it can broadly be divided at 5 levels. At the basic level is the government run or the MCGM run system. A level above is a charitable hospitals run by various NGOs or charitable trust. The third level can be a nursing homes setup. A level above that, fourth level, can be a semi-corporate hospitals, which are run but not by companies or corporate houses. And finally, at the apex, we have this corporate hospital run system. For a doctor who has just completed his post-graduation, who has completed 2 to 3 fellowships, and is now looking at jumping into the private sector. With this 5 system in place in our metro, what is your suggestion to the newcomer, how he position himself in this 5-tier system?
Okay, I give Manish the time to think and I start.
No.
So, well, I am very clear about it. Each one on his own.
Absolutely.
When we go for a buffet, we basically walk from one end of the buffet to the other. One of those things appeals to us, so we try a little bit of it. We like it, we take more. That's how most people do. There are a few people who take a lot of everything in the plate, and then they are in trouble. So I would say each one on his own. All systems have their pros, cons, ifs, buts, and there is a sort of a SWOT analysis that you can do on all of them. But please understand that whatever you do, if you do it with a sense of purpose, with a focus, you can exceed wherever you are. Okay. And then give it adequate time, and then decide when you wish to move and go in which direction. You cannot believe that everything is Amazon Prime and that within a few months you will realize whether the system suits you and you suit the system. So it has to be an adequate period of time. And when I say adequate period of time, I say few years, if not half a decade at least. And then decide the way you go. Mumbai, unfortunately, and I am always use the word unfortunately, is still a place where very few people are attached to one institution. I'm saying very few because if you look at the majority versus the minority are attached to few institutions and single hospital. Most people are still going from A to B to C. And in fact, try to be at 3 of these levels that you just spoke of. Am I clear? You gave 5 levels. Most people want to be in 3 of these levels. They want to be represented everywhere. That's how most of them aspire to be. And then finally take a slot that suits them the best. And which is the highest among these 5 slots, wherever they may be, is where they then start concentrating. So yes, we need people to be full-timers and good teachers in medical institutions. Yes, we need them. We also need people to handle the robots and the O-arm. But then we need people in between as well. So as I said, my vision and my hope is that we have hospitals, the quality of the top level corporate hospitals, but where a common middle income person can walk in and can get quality of care. May not be from his own pocket, but maybe from some crowd funding as well. And this can only happen when there is something like a limited PPP, like a public-private partnership that comes in and creates these setups. So this is how I look at it. So a youngster should actually even look at working together as young teams. I'm talking something slightly odd. Give it a thought. If 5 guys who've passed in the last 5 years have taken 5 different subspecialties of orthopedics, okay, they should all start working together and see the force that they can create. Believe me, they can be a big force. So this is my suggestion. I couldn't do it. Maybe the next generation can. Over to you, Manish.
Yeah, I think each one has to decide where they are comfortable working. And I firmly believe that it is not the walls of the hospital that are important, but the kind of care that the treating team can provide in the environment, which is going to finally make the difference. So as long as you have a good operating theater and good post-operative care, then I think you can make your practice work in any hospital as long as you can give that quality of care and the outcome which the patient expects. All other things are related to what the cost is going to be to the patient. So that's the reason why people will choose various different hospitals, because they want to cater to different strata of society. Some, like we said, middle income may go into the nursing homes, the top income or those with insurance will go into the big corporates, and the poor will go into a public hospital where there is research and teaching. So a good balance would be to have each of these levels covered in your practice. But is it easy to manage everywhere? And I have struggled with this because the kind of infrastructure I need, we have to cultivate, we have to develop the teams, and it may be impossible to do it at multiple places. So it's better to do it at very few places. But those who are doing a different kind of practice can decide what they need and then set up their practice anywhere. And there is a well-known saying that cream always rises to the top. So the moment you can deliver good results at an effective cost, I think there is no shortage of the hospitals where you can get attached to.
Thank you for your valuable input, sir. Dr. Ashish, do you have any questions?
Yeah, I mean, I just noted down something. Right. So, so as Dr. Agrawal mentioned that, it is quite a rigid system that you want to do a smaller procedure also. There are certain protocols that they follow, and therefore the cost of healthcare goes up. In your experience of multiple hospitals where you have worked, is there, do you see a change or an attitude of the corporate hospital to sort of do a, like what Dr. Chaddha said, a public-private partnership? Sometimes the question comes to our mind that, why should a patient in KEM or a Sion not get the kind of wards or the disposables or the consumables that are available in a corporate setup to to each and every patient that is being used. It could happen in the NHS. It happens at certain state-led healthcare facilities. So what we as a society could do to sort of
well, see, a patient from KEM today, for example, suppose he needs tumor surgery and comes to us, we can give them the same care that we give to the other paying patients at any of these hospitals where I work in. Because there are beds which have been reserved for the economically weaker section. And as long as the administration is going to allow you to use those beds and use that facility, I think you can deliver that care. Now, other thing is of developing a system like I did it at Wadia Hospital. We have a sarcoma unit now. So, which is an alternative for any children with cancer. So we've got donors to donate the equipment. We've got an NGO which looks after their other requirements of chemotherapy costs.
Probably we have lost the link with Dr. Manish Agrawal, sir. Dr. Chaddha's
corporate hospital on that. So I think finally it comes down to how you can provide that care and at what institute you can downgrade the surgery. And we are now working with the management of Max to really bring in packages for these patients, like I told you, for smaller surgeries or say a VAC dressing change or something which is done repeatedly to bring down the costs for the patient. So that can be done. I think it is up to the doctor to take the initiative, take the proposal to the management and convince them that this is required and still not going to make a loss for the hospital.
Dr. Chaddha, sir, would you like to take that same question?
Well, I'll be very frank. As mentioned by Manish, there are various one-off rules that we can bend to make things more comfortable for the exceptional patient. And we've always been doing it. But somewhere, as the thought process needs to change, where we as doctors need to sit across with the managers. And when I say managers, it means anybody who's running the corporate on the other side, maybe an MBA, maybe an owner of the hospital, or all of them together, and look at things which work out. Because see, as Manish has mentioned, and I was just trying to draw a parallel between the hospital and the hotel industry, where when you go to a hotel and you take either a set menu or you take a buffet, you actually pay a lesser amount than you would if you were to take all those individual items separately. So the reason that a biopsy of 5,000 rupees on outpatient is charged as 60,000 in the OR is because they look at that 5-minute procedure as a 1-hour procedure. These are those fixed set of rules. So probably if Manish and team would probably have 6 of those biopsies within that 1 hour, they would be happy doing it for 5,000 rupees each. I'm just sort of giving you an idea, but that's how they calculate. And somewhere we need to sort of draw that line where there is something like a level 0 surgery, or, something where it's actually an outpatient procedure being done for the safety of the patient in the OR. So that discussion has to happen. And I think it makes a lot of sense, because at the end of the day, why is he not doing it in the OPD? Because he cares for the sepsis and the asepsis of the patient. That's the only reason why he's not doing it there. So we have to look at those things. So
Thank you.
We need to think forward, and such discussion should have the healthcare provider and the manager together on the same level. So in future, probably a few of us should do MBAs and get into healthcare.
Yeah, enough of them, Ram.
Thank you again for the valuable Yes, sir. Please continue.
No. I think the clinical, we need us to do the clinical work. I think we are better at it. I don't think I'm a good manager at all. And I would leave the management to those who are experts at it.
Sir, carrying my first question forward. So suppose this same postgraduate who has completed his fellowships, and we discussed that in a tier 1 city like Mumbai, where it's a 5-tier healthcare system, vis-a-vis if he moves to a tier 2 city or a tier 3 city. In a tier 2 city, yes, some corporates have now been have reached. So in a tier 2 city, it's basically a 3-tier healthcare system, a corporate, a government system, and an individual run system. Whereas in a third tier city, it's just a 2-tier system, a government system and an individual system. So what's your suggestion for the new budding orthopedic surgeons who have come out and who are going to place themselves in tier 2 or tier 3 cities? Because we have viewers for these programs even from the interiors of Maharashtra and from the rest of the country.
Well, I'll be again taking the first call because I'll give Manish some time to think and give a more sensible answer than I do. But what I would like to say is that, like there are advantages of being in Mumbai, there are great disadvantages of being in Mumbai. Okay. So if you are going from Mumbai, let's say to Pune, which I'm saying is now at par with Mumbai in every which way, but which probably 20 years back, you could still establish a large setup in Pune, which could be a surgeon-driven setup, which unfortunately in Mumbai, but for 1 or 2, have not been able to have surgeon-driven large centers. So please understand that if you are going to let's say a Pune or a Nagpur or anywhere else, you can actually create as much quality and have very good setups. I mean, I sort of moved from Maharashtra out to Tamil Nadu, and I know that places like Coimbatore and Madurai have larger setups and bigger setups than those in Chennai. So I am trying to tell you that you can actually create a big niche, not in the tier 1 as you were calling it, but in the tier 2 and the tier 3, and have large setups. I mean, I know of Indore having brilliant setups as compared to Bhopal. I know of Chennai and having not as good setups as probably a Coimbatore or a Madurai. So I'm just taking sort of giving you these sort of options. There are enough setups all over the country which are extraordinarily placed. So I would suggest that you sort of look at going to a place which is comfortable for you and where you can establish yourself. Wherever you go, you will have patients coming to you. If you have quality, people have traveled across and have gone to all parts of the world. In fact, if you look at places, there are cities that have been evolved around hospital setups. Cleveland has grown across the Cleveland Clinic. Johns Hopkins is probably the largest success story of Baltimore. So I'm just trying to, there are places all around which have created around hospital setups.
Mayo,
today, talk of Johns Hopkins are various small buildings assorted all over. It's not a large, big setup, but we think it's one of the top hospitals. So it's something that you have to look at.
Yeah, so I think first the important thing for anybody who starts out is don't think of earning only money. You have to provide a quality service. And as long as the direction is there, I think it is actually probably easier to do a setup. As Ram said, your costs are much lower of starting practice in a 2-tier city compared to a big metro where the competition is also more and your costs may be more. And that's the reason why everything, you have to just decide what works for you and start working that way and provide good quality care. I think ethics is what is going to finally matter. How you treat a patient and the way you deal with them is finally going to decide how your practice goes.
So those were the words of wisdom from 2 very experienced panelists. Over to you, Dr. Ashish.
Thank you very much. Thank you, Abhijit. And we had a very interesting conversation. Actually, this could go on and on.
Yeah.
And there are a few, I think Michelle and Abhijit cover all the 5 tiers of the healthcare currently. I think they are attached from teaching hospitals in public sector to corporate hospitals as well. And we had very good insights on these hospitals having specific protocols, all these accreditations, which actually make it a safer place. Having said that, the doctor does provide good quality healthcare even in smaller setups. But I'm not sure if corporatization of healthcare is going to be the norm for the next generation. We might see even KM and Scion or public institutes being managed by managers rather than and helping out deans of those medical colleges, execute certain protocols and processes. So I thank you very much, Dr. Manish Agrawal and Dr. Ram Chaddha, sir. Thank you very much for being with us today.
Thank you. Thank you.
And I would also like to tell our viewers on this curtain raiser that a lot of these topics will be dealt with during WIROC. As Dr. Parag Sancheti mentioned, there is a session on scaling up and is it volume with value. There will be a session on certain apprehensions of surgeons who take their patients or who operate in corporate setups regarding billing, insurance matters, and how that is impacting the private practice at the moment, and how it is going to impact our practice in the future. There are sessions on the doctor-patient relationship in view of these changing paradigms of practice, whether it is in a government sector, teaching hospital or private. So quite an interesting program we have put together. And to give you a brief update, the WIROC is just around the corner. It's just a week away. We have reached the mark of about 1,000 registrations, and we are very enthused with the active participation of our delegates and our members. As I mentioned earlier, we have got a record number of abstract submissions for the free papers, and we have been able to accommodate a larger number of free papers as compared to the previous papers. A very good quality of papers across the specialities. The things that we are doing differently this year, apart from academics, there is also a social and a cultural aspect to WIROC this time, where we are highlighting and giving the orthopedic surgeons an opportunity to highlight their hobbies, their skills, and anything but orthopedics. Regarding the sessions, we've got more than 80 academic sessions, which also would include certain hands-on workshops of newer aspects of orthopedic practice like 3D printing, virtual reality training gadgets, and the newer implants, robotics, and certain hybrid courses which we plan to sort of make it a norm in WIROC in the years to come. So I welcome you all for WIROC this year, and that's all for the curtain raiser. And we would see you next time physically at the Geo World Convention Center on the 29th of December this year. Thank you very much.
Thank you, Ashish.
Yes, before we conclude, I have always believed that technology has to be enabler of the process that otherwise needs great degree of human intervention. It is in the roller coaster journey that we realize the inadequacies and the disparity in the healthcare system that is plaguing in our country. One inefficiency in particular is the gap that exists between the lives of doctor in individual practice and the lives of doctor under the corporate banner. Running an individual practice is hard. Running an individual hospital is even harder. The reason is simple: the resource crunch. The evolution of medical knowledge has been exponential in past 40 years due to new ways of learning that have been discovered. What requires to be done is to ensure steps in the right direction to accumulate the years of practical knowledge of doctors and bring the giant talent pool of medical professionals both for the benefit of patient and practitioners alike. With this positive note, we wave you a good night, and on the behalf of Bombay Orthopedic Society and the organizing committee of WIROC Max 2022, we thank Dr. K.H. Sancheti, Dr. Parag Sancheti, Professor Dr. Ram Chaddha, and Professor Dr. Manish Agrawal for the valuable contribution they have given to this 4th episode of Curtain Raiser. We look forward to see you in person at WIROC Max 22 at the Geo World Convention Center from 29 December to 31st December 2022. Good night and see you soon.
Thank you. Thank you.